Endocrinal cancer is cancers of the endocrinal system. They're cancers that have to do with your kidneys, adrenal gland, pancreas, or thyroid.
Cancer can arise in the adrenal glands just as it can arise in any other tissue in the body. When it does, it's called primary adrenal cancer.
The symptoms were very subtle. I would have a feeling of just nearly exploding as you went along. And what it was that my adrenal gland was giving me a terrific shot of adrenaline. So I could work, or I might sleep for 2 hours for 3 nights, and then I'd be a dead duck for a week.
So Derek was typical of most patients who present initially with this tumour in that he was relatively asymptomatic.
Here I am going along normally one day. I'm smashed up by a couple of bulls in the cattle yards over there. I'm laying in hospital. I'm told that I have cancer. I have limited time left to live and virtually no hope. Everybody, and I did, go through the full range of emotions, and I think everyone handles it in their own way. With everybody's help, I was able to find Professor Bruce Robinson, who consults and operates out of Royal North Shore Hospital.
The Kolling Institute of Medical Research at the Royal North Shore Hospital is affiliated with the University of Sydney. All of the academics, the professors who work within the Kolling Institute are people from the University of Sydney, and furthermore, all of the students who are doing their PhDs or master's degrees at the university are doing them at the Kolling Institute. So my role was to develop a plan of action for Derek and Heather to help give them confidence that we had seen patients with this condition before and that we knew as a team what we needed to do.
After meeting Bruce, he explained clearly that I had no more than 6 months to live unless I had complete radical surgery. I can remember that I left his office, and after what was an emotional few hours, I was sitting on the side of the road when he was kind enough to ring me back, and he asked me to meet the surgeon and say, come and have a chance at life again. So I went and met Stan Sidhu.
So a patient like Derek who came in with a large adrenocortical cancer, I worked in conjunction with my endocrinology colleague, Professor Robinson, and other surgeons at North Shore to facilitate his surgery.
At one stage, I was under radiation therapy. They were considering discontinuing it because the consensus was there was no benefit. I was going to pass on anyway, so why go through that pain? It was only due to the determination of Bruce and Stan that I'm here talking to you 18 months later.
He's recovered very well, and he's ended up being an inspiration to our team at North Shore. Obviously, when you have an orphan cancer that affects 1 in a million or 2 in a million people, government aren't interested in funding it. They're more interested in funding common cancers, which is entirely reasonable. However, it does leave people with his sort of cancer in the lurch because there's been very little progress in this field over many years. Now, we're one of the 5 or 6 centres in the world that actually have a bank of adrenocortical cancers and actually have researchers working on it. So when we have someone like Derek and his family and his community that have rallied behind him, it gives us hope that, maybe we can make a difference, even though we're faced with the commercial realities of not being able to fund our research in an ongoing fashion.
I'm still on daily oral chemotherapy. There's no guarantees that I'll live on and how long that I'll live on. But with the team that I have behind me, I have the best chance possible of the most time possible on this earth.